Overall, 6,199 individuals have been tested for COVID-19, and of those tested, 856 tests are pending. I will now share the most current case counts. There are 48,500 confirmed cases of COVID-19 in Canada and 14,856 cases in Ontario. Chatham-Kent has 75 cases, and Sarnia-Lambton has reported 178 cases. Michigan now has 38,210 cases, with 8,679 cases being in Detroit. Today, we are reporting 581 cases of COVID-19 in our community, an increase of 12 cases from yesterday. 41% of our cases have occurred in long-term care homes, including both residents and staff. 159 cases have been resolved. 23 people remain in hospital. 17% of our cases are between the ages of 50 and 59 years, and 23% of our cases are 80 years or older. 40% are male, 59% are female, and 1% remains unknown at this time. Our community has lost a total of 43 people to COVID. 30 deaths have occurred among residents in long-term care and retirement homes. Our health unit continues to work with 6 long-term care and retirement homes that are currently experiencing COVID-19 outbreaks. Testing for COVID-19 is based on a clinical assessment. Symptoms include fever, cough, difficulty breathing. However, other symptoms may be present, such as being extremely tired, falling, nausea, vomiting, chills, headaches. If you are feeling unwell and need to seek a health assessment for COVID-19, there are several options. Complete the online assessment tool available at ontario.ca, contact Telehealth Ontario, or call your primary care provider for a phone or virtual assessment. They will be able to guide you in next steps, including contacting public health or attending an assessment center. To access the virtual walk-in clinic, please visit ehealthwindsoressex.ca. Windsor-Essex has 2 assessment centers, Erie Shores Healthcare in Leamington and Windsor Regional Hospital Alette Campus. Please note that testing is available for people who have symptoms of COVID-19. Please continue to visit WECHU.org for the most current information and case counts. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health, for further updates regarding COVID-19.
Good morning, everyone. It is with incredible remorse that I report the loss of 5 more deaths in our community related to COVID-19. 2 female in their 80s, a female in her 60s, a male in his 50s, and a female in his 50s. All these individuals were positive for COVID-19. Each of these individuals have a family and that is grieving a great loss, and I wish to express my sincere sympathies to them. As we are coming up with new guidelines and new recommendations for the residents of Windsor-Essex, we know that many of the residents in Windsor-Essex rely on public transit for their essential transportation needs, and the health unit put out recommendations for public transit system to ensure all measures are in place to protect our transit employees and the public who rely on transit system. The full recommendation on transit use can be found on our website, but I'd like to highlight some key recommendations, especially for the transit riders. Do not take public transit if you're feeling unwell or have any symptoms suggestive of COVID-19. Allow space to maintain physical distancing from each other and from the driver. Do not touch any surface in the bus shelter while you wait for the bus. Keep and use an alcohol-based hand sanitizer to clean your hands before entering the bus and after exiting the bus. Wearing a facial covering or non-medical mask in the community has not been proven to protect the person wearing the mask. However, it can be considered as an additional measure you can take to protect others around you when physical distancing is not possible. Remember, wearing a mask is not a substitute for physical distancing and hand washing. On another recommendation, as the weather warms, the community is beginning to contemplate yard and pool maintenance. The Windsor-Essex County Health Unit has received a number of requests to provide guidance and direction for these services. The Emergency Management and Civil Protection Act identifies the essential businesses permitted to operate and conditions of operations for both essential and non-essential businesses. Lawn care, landscaping, and pool maintenance services are only permitted to operate if providing services that is necessary to maintain safety, security, and sanitation of properties. Today, we are providing our guidance for essential landscaping and pool maintenance considered necessary for health and safety of the property owners and the community. In particular, to ensure properties remain free from tall grass and standing water to prevent tick and mosquito breeding habitats. Permitted services include lawn cutting, yard maintenance, clearing of debris such as leaves, branches, dethatching and rolling, fence or deck repairs, pool maintenance. All other landscaping activities for aesthetic or beautification of purposes should be suspended and are not permitted at this time. This includes new fence construction, new deck builds, or new pool installation. In our guidance document, COVID-19 guidance for lawn care and pool maintenance service providers, that is available on our website, the Windsor-Essex County Health Unit further outlines instructions for the safe operation of these services for both employees and employers. These recommendations are important to ensure the health and safety of our community during and residents are, most importantly, to workers providing essential services. While I recognize everyone is ready to get back to normal, it is important that it is at this time we continue to limit the trip outdoors to only what is considered essential. Thank you.
We'll now start with questions from the media. We'll start with CTV.
Yeah, just playing off your transit line, just curious, when it comes to ridership, should Transit Windsor provide hand sanitation for riders, as soon as they get on the bus, that kind of thing?
So we put out a recommendation and responsibility on both, and I think it's a lot easier for the riders to have that available in their pockets for their own safety, especially when they're getting on board the bus and exiting. Having something that's installed by the transit system, that's a possibility too, but I think given it does require a different infrastructure, so I think I would leave that decision to them to make a call. But as a rider, I think they should take that appropriate precaution for their own safety.
Any questions from AM 800?
Yes, I was just wondering, I've seen a lot of comments online, saying that the media are adding to the hysteria of, everything that's going on by reporting the updated numbers daily, both in deaths, sadly, and in the number of cases. And people are saying, people die from the flu, people die from this and that. So I guess, can you just give us, a reason, if we must, on, why this is different and why this is a much bigger deal than, the regular seasonal influenza?
So first of all, it is different than regular influenza for various reasons. First of all, the most important piece is the mortality that is associated with that. The number of people that die from influenza is very different than how many people are dying with COVID-19. The fatality rate when we are looking for influenza, it's anywhere between 1% and 2%. But what we are noticing from our COVID-19, even locally, it's close to 4%, which is concerning, and which is like double the number of deaths that we are talking about. With flu, there's a lot of natural immunity in the people too, and not everyone develops that severe consequences with flu. Our body has seen flu before, and they have the antibodies for it. With COVID-19, our body has never experienced this virus before, so there is no natural immunity against it, and that makes it very different. And I know like people can be on different sides. Some can be more scared than the others, and some can be can go on the opposite and thinking that, oh, it's just normal. It's not normal when you're looking at the statistics around the world and how many people are dying, and even people who are dying in our community. Those are all real people, and those are all individuals who otherwise would have lived a normal life, especially the younger ones, what we're talking about. So I think it is almost concerning that these deaths doesn't mean anything to anyone. It does mean to us, and it does mean to the families who are losing their loved ones. So I think we should be respecting them, and the need for information is there. We are trying to be as transparent as possible to provide the information in a timely manner, and people can make a decision on their own whether they feel that it is useful for them. Those who find it useful, they will continue to look for it. Those who don't find it useful, I think they have a choice too.
Okay, thank you.
Any questions from Windsor?
I don't believe. Thank you.
Any questions from CBC?
Yes, good morning. Franklin Gardens is back on the outbreak list. One resident, one staff member. They were considered out. So is the 2-week time span maybe not long enough to call an outbreak completely done?
Well, 2-week timeline is based on the incubation period, the maximum incubation period that we can see for this COVID-19 disease, and so those recommendations are based on it. When we are doing mass testing, that's where we can find some of the additional cases and anyone who can develop symptoms later on, and that does put a home under outbreak again and requires all those measures to be in place, and we'll continue to do that. And it's possible that there could be other homes too that after they come out of the outbreak, and if they have a case, we'll put them back in outbreak to ensure that we are protecting the other residents as well. There are a number of measures that are put in place. Some are proactive measures and that are currently being implemented, but it's unfortunate that despite all those measures, because COVID-19 is very contagious, people still are getting infected, and I think we'll continue to monitor that. And as new homes come under outbreak, we will notify the community, and we will work with the homes to manage the outbreak as soon as possible.
You know, if those cases, I'm sure during the contact management, were they got COVID from being inside Franklin or from community contact yet?
It's hard to say at this time. Obviously, the residents that are in the facility, they're not going outside. No one's coming inside. The only people that are going back and forth are the healthcare workers. So that's why we are focusing our attention to them to make sure that we are doing a good contact tracing to identify the potential source of them contracting the disease, and that's been our focus with all the long-term care homes as well.
Okay, thank you.
Any questions from the Windsor Star?
Yes, good morning. Did all 5 of the individuals who passed away die yesterday, or could it have been a few days before?
So we do use a cutoff timeline just for the sake of communication at 8 p.m. the night before. So any deaths that are reported between 8 p.m. till the next 8 p.m., so those are the ones that we are reporting. So all 5 deaths that we are reporting were up to last night, 8 p.m.
Okay, thank you.
Any questions from Blackburn?
Yeah, so I think I missed, was it female in her 80s? Could you just go over the ages of the death students?
So we have 2 female in their 80s, 1 female in her 60s, 1 male in his 50s, and another female in her 50s.
And were these people, do they have any other underlying health conditions?
Well, obviously, almost all of them had underlying health condition, except for one, the 50s female. She was being investigated for a number of things. Other than that, everyone had some kind of underlying health condition.
Any Any further questions from CTV? AM 800? Windsor-Essex?
Yeah, sorry, just,
Okay.
just piggybacking off Maureen's question, so if all of the people had underlying health conditions, is COVID-19 listed as the cause of death or like a contributing factor, or how does that work?
So when we're really looking at the cause of death, what happens with any kind of underlying condition such as a cardiac condition or a respiratory condition, it makes the body weak to fight off any infection. What the mode of death or cause of death for it with COVID-19 is typically pneumonia or ARDS that gets into the lungs, and that makes it very difficult for a person to breathe. And at the end, they may need some kind of assisted ventilation or ventilator support. When the body is weak, if they have a cardiac condition or if they have a respiratory condition, it makes it even harder. And so that's why it is a contributing factor, but cause of death is typically listed as COVID-19 because that's what it precipitated all that condition.